What's up, everybody? You are listening to the Strength and Knowledge Podcast. I'm Dr. Zach Baker, and I have with me today Dr. Corrie Jones, Director of Clinical Excellence at Rehab to Perform, and she's going to talk a little bit today about return to plyometrics. And when we think about returning to plyometrics, it often indicates that we're moving into a new phase of rehab. And in order to do this safely, we need to make sure that this individual is at an appropriate time frame to do so. So with respect to the injury and whatever that body part is, whether it's a bone, whether it's cartilage, whether it's muscle, tendon, ligament, making sure that we've had logical healing timeframes take place so that they're at an appropriate point in their rehab to begin stressing it. Then the second part comes down to, are they functionally ready? And this is kind of opening Pandora's box in regards to how we actually quantify that. But Corrie, assuming the person is at a time frame post-injury where it's medically appropriate to begin returning to plyos, how do you go about a checklist of, are they actually ready to begin plyos? What's your kind of working framework that you like to discuss?
Yeah, so I'll be a little bit nerdy at this point, but you have to bring up that force velocity curve. So if I'm going to start introducing increased velocity and I'm going to start introducing gravity into a situation, which is plyometrics, right? Then I have to just make sure that they have some of these objective strength prerequisites before introducing these two new things, like you said, in a new phase of rehab. So the first thing, as simple as I can say it, is just objective testing to say this person has the strength in order to tolerate landing with a greater velocity, which requires more neurological input. And in addition to that, they can handle gravity. So more than just their body weight. So I think it's really making sure you spend the time testing, whether if it's for lower extremities, maybe you're really looking at rear foot elevated split squats, maybe you're looking at lateral squats, you're looking at some stuff under load to see if they can handle a much higher load than what you would normally do in a daily activity, because sports require more loading capacity, right? So we have to have the capacity to manage force. Another option for objective testing might be Tyndall testing or isometric testing. That's going to give you a part of the picture. There's less neurological control there, but at least you're going to see, can they at least generate force with the muscles that you're asking? And then the good thing about Tyndall is you can compare that to body weight, because once we start introducing gravity, if they can't even handle body weight, then gravity plus is going to be harder. So it really helps you start making decisions about torque ratios and such like that. So really doing objective testing to say, I am ticking my boxes to say this person can first handle force. Then if we're starting to talk velocity, hey, I can actually handle doing this quickly. There's a neuromotor component there. I actually have good neuromotor control while I'm doing these things under a heavy load. So as a therapist, I'm thinking if they are doing anything under a heavy load where I'm still having to administer cueing or give some sort of external constraint that helps them do the movement better, the fact that they need either cueing or more audible input, more verbal input, more external constraint means that they might not be ready for velocity, because even in controlled things, they still need a little bit of help and they still need a little bit of direction. So that's kind of like helpful too, to say like, are they functionally ready to do what I'm asking them to do? So I would say like objectively, that's what it is. And then it kind of leads into what have you done movement wise before getting to those plyometrics as well, right? So we can talk a little bit more about that, both of us, but one of the big things, if I'm going to add, let's take a snap down, right? If I'm going to take a movement pattern, which would be a squat, and I'm going to add velocity to it, I need to know that the squat looks good. I add velocity to it. That looks good before I ever leave the ground when I'm managing force, velocity, and gravity. So I think it's just kind of consistently seeing, have I done the slow progressive overload? Have I had the building blocks to the plyometric movement performed before in clinic without needing additional cueing? Because as soon as it starts leaving the ground and has velocity, I don't have time to cue. Plus, usually we're starting to talk, hey, there's dual tasking going on and some cognitive changes as well, because now I'm paying attention to other things too. So I would say at least that's a good starting point to say, am I functionally ready? objective testing. Have I done the movements before? Have I done them with velocity? And have I done them against gravity?
No, I love that. And I think when you really break it down, there are some formal components that we can do. And we can talk about just traditional orthopedic testing, ensuring that they have all of the measurables to either ensure limb symmetry or pre and post injury comparisons or normative data, or maybe for whatever injury they have, there is specific metrics that they should be able to do prior to beginning running or other types of plyometrics. Oftentimes, we don't have that. We don't have anything beyond just your traditional orthopedic testing and your own clinical intuition. So you almost have to reverse engineer the process. What is that terminal task that they're trying to get back to doing? Are they a snowboarder? Are they a soccer player? Are they a dancer? Are they a swimmer? What is it that they need to be able to do? And then you simply just bridge the gap. All right, well, what have they done so far from a strength training standpoint? What do they need to get back to with regards to sport specificity or occupational demands? And what's lacking in between? What have we not done yet? Then you get to modify all those different parameters you just talked about. Do we need to increase resistance? Do we need to increase velocity? Do we need a specific direction of force that we're trying to produce? Is there any contact or impact or reactive nature to this? And you try to figure out, based off their injury, based off their performance of previous tasks, what do you think they're going to tolerate best? What's the next thing that we can manipulate that's going to make it harder, but it's not going to lead to catastrophic failure? It's not going to lead to too much complexity or confusion. And sometimes that's easy. Sometimes that's not so easy. What are things that you find yourself either having some sort of like algorithmic system? Are you modifying stances? Are you modifying speed, velocity? What do you find yourself usually doing with the majority of your patients from basic to more complex plyos?
Yeah, I would say one of the progressions that I would say I really have learned, luckily early in my career, and then really stuck with as I've gone on, is just moving along that spectrum of non-counter movement to double contact, continuous, and depth drops. The nice thing about that is that each phase helps you to understand how you're going to progress people, right? So non-counter movements means that I'm already set up in a way that I'm only going to use the eccentric portion of a movement, or I'm only going to use the concentric portion. So the way we describe that here at R2P is those are acceleration drills and deceleration drills where I am trying to use those movement patterns with velocity, but I never leave the ground. So an eccentric variety might be snap downs or falling lunges or base step offs or something like that. We call them Michael Jackson leans, where I have to kind of catch myself, right? Or you can do concentric varieties. So that might be a Bosch step up. That might be a wall drill where you're doing a load and lift with a little bit of speed. Some of these things that you're working on without ever leaving the ground. I need to have competency in an eccentric motion with speed and a concentric motion with speed before I ever ask somebody to leave the ground and add gravity to this. So non-counter movement, hey, let's make sure we spend a lot more time in that. That might even be bungee work and some of that stuff too. I would say that is the most underdeveloped and underused phase of rehab for all PTs, myself included. If we stayed much longer in that category and we worked on those things for longer periods of time, we build up that stretch shortening cycle, the neurological components of what we're asking the body to do in a collaborative nature and a dissociative nature. Man, do we start seeing that plyometrics are easier. The body already understands those motions. It already understands the speed. And then you can start getting after plyos without cueing and without external constraint necessities. So then you got your non-counter movements. Hey, these are dialed in. They look really good. I'm not having to cue anything. You got your counter movements, which everybody knows they're kind of like more of your natural jumping, hopping progressions. Then you got double contact, which means I have to be able to store energy and use it a second time. And can I manipulate that? Can I make a small jump turn into a larger jump with the second one and vice versa? So do you have the capacity to store energy? Then you have continuous jumps, which obviously that just means you keep going for high reps. That's fatigability. Can we have fatigue resistance when we're doing some of these plyometric drills and build up that fatigue resistance so that that's not a factor when our athletes go back to sport? And then the very last one is depth, right? So you're jumping from a height or to a height or whatever. So you're manipulating gravity because now I have to do something that's like a higher amount of body weight. So that little progression for me has been very, very helpful. Then you can pair it with what you were just saying, base of support. It's 2 foot to 2 foot, or 1 to 2, which would be a little bit more of a concentric bias, a 2 to 1, which would be a little bit more of an eccentric bias, or a 1 to 1 bound, or a 1 to 1 ipsilateral hop. You can kind of manipulate those things. And then the fun part starts. So that's where it's like, you still have to do the objective testing because that's your basic progression, but your objective tests are going to say, this person has less difficulty with a larger range of motion than a small range of motion. Maybe they have more difficulty in the frontal plane than they do in the sagittal plane. Maybe they have more difficulty when they're loaded versus unloaded, right? Maybe a vertical bias is more difficult for them than a horizontal bias. Usually it's the flip-flop. Usually horizontal is a little bit harder because now you're dealing with momentum as well. But those are the kind of things that you can start manipulating because you've either seen it with movement observation, because we have to be really good at that point at observing movement and observing that movement quality, or looking at that in combination with your objective testing because you've seen something already on your objectives that says, hey, I should probably be watching this a little closer as far as qualitative movement patterns. So that's where it's fun because there's so much to manipulate. But when you're teaching students or when you're teaching plyometrics, those are the considerations that you have to have so that you're not just randomly prescribing these things, but you're literally giving a framework and a foundation that's really, really solid that now I can build on that with each session. The big thing I would see with therapists is rather than just throwing things at someone, have an emphasis on the day. Today, we're working on depth drops with a horizontal bias whenever you land. Or, hey, today we're working on single leg activities where we're going ipsilateral leg to ipsilateral leg. And I really want to emphasize vertical change of direction in a frontal plane, right? So if we try to mix it up too much, we are going to get lost in the sauce, right? But if we really try to zero in on the emphasis of what we saw is still clinically difficult as far as our objective testing, we're going to be able to really guide this athlete into what they need. So I think it kind of comes back to what we already said, but do your testing, make sure you look at that force velocity curve and what they can handle. Use your structured progression in plyometrics so that you're really helping an athlete have a good foundation moving to really excellent movement quality.
I love it. It's a combination of formal and informal checkpoints. But no matter how formal or informal they are, they need to be intentional and they need to be strategic. Corrie, appreciate your input and your insight. If you enjoyed this episode, please share, like, and subscribe. You're listening to the Strength and Knowledge Podcast. I'm Dr. Zach Baker and Dr. Corrie Jones. Thanks for listening.